Hi, I'm Daryl Newman. I'm the head nurse of quality improvement at the Harris County Sheriff's Office here in downtown Houston. And I wanted to talk a little bit about some of the measures that we've always taken and some of the measures that we've taken now in preparation for potential community spread of COVID-19. We do have experience with a mumps outbreak, a measles outbreak, and we routinely necessarily have to quarantine some of our patients from exposure to other patients to keep everyone safe. And so we're accustomed to dealing with those situations and providing the patients with those protection. To me, we have a huge responsibility, first and foremost to the patients that the county and the sheriff has entrusted to our care, to make sure that they're well and to make sure they're protected. And so some of the measures that we put into place, for example, at our new joint processing center, we have 24-hour physicians and nurses and medical staff that are available there in a clinic environment at the booking process. But before you ever enter the facility, the Sheriff's Office has put in some stopgap questions, and those are informed by what the CDC recommends as screening questions. Could you possibly have been exposed? Are you possibly ill from the virus? If you answer in the affirmative to any of those questions, you really are not allowed into the open portion of the facility until a physician from the second floor of that facility comes down and assesses you at that point. At that point, a decision is made by the doctor as to whether you'll be admitted into the facility, into the jail system, or if you'll go to the hospital directly from there. But that was one of the first stopgaps that we put in place, and that was actually before the very first patient with COVID-19 popped up in the U.S. We were already doing what the CDC had recommended. So our first measure is to prevent those that might be infected with illness from entering the facility here. Secondarily, if we do have a case that were to come up in the jail, either with a new arrestee or with somebody that's already housed, we have quarantine tanks set aside and ready. We have providers and nurses and other medical and psychiatric professionals that are ready to care for just those patients in those quarantined areas. And so the sheriff has been very proactive in not only instructing us to do everything prior to an event, but he's also been very supportive in allowing for us to make those preparations and to put in place the things that we need to put in place to be as ready as we possibly can. For our patients in-house, we have test kits available here and are ready to administer those tests to test any patients that may have a patient narrative that indicates they were exposed or have symptoms of the disease or the illness, so we can actually test in-house. As far as our county employees, of which I'm one, along with all of our security and detention staff, Judge Hidalgo and the county health department and the city health department has set up a hotline for us. And so if any of us develop symptoms or if any of us may have been exposed in a way that we know to be the case, we have a hotline that we can call where we're instructed what to do, how to self-quarantine, how long to stay away, and who we should contact in turn for ourselves to be tested and possibly be treated as well. And the hotline number for Harris County employees is 713-274-3880. There's also an email address here. Both of those, the number and the email address, connect you with a public health task force. And they will instruct you as to what to do, who you should contact, and where is the best place for you to go and receive testing or care. We do routine germicidal mopping, germicidal wall cleaning. Our workers are very proficient in cleaning this. Everything that we've always done has put us in a good place to be able to tamp down illness and disease in the facility. And so we feel like that just by best practices of wearing personal protective equipment, of the things that we've all heard on TV, good hand washing, wearing masks if we feel like we're going to be in the company of someone that might have been exposed, and then of course the good cleaning that we already do with the germicidal agents. Currently, we have no active cases of COVID-19 in our facilities. So your families and friends should rest assured that there is no active COVID-19 in our facility. With that said, because our population is fragile, our population is aging inside our facility as they are in the community, Sheriff Gonzalez made the difficult decision to limit and suspend visitation as long as a public health crisis exists. We feel like, and we agree, that this is the best way to protect our patients in-house, and also to offer a degree of protection to our greater community, because just like you, we're a part of the greater Houston community, and so anything that we can do to assist in slowing down the spread of COVID-19, that's what we're about, and so that decision has been made.